Hi, good morning, Desiree. Well, the 20 doctors from Cuba have arrived here in the Northern Cape. They're currently being briefed and made ready to be deployed to various areas within the Northern Cape. Of course, 5 districts in the Northern Cape. The Northern Cape currently the least affected by the COVID-19 infection. But let's talk to the Premier of the Northern Cape, Dr. Zamani Saul. Dr. Zamani Saul, not part of the Cuban doctors, but what will they be doing here, and what is our risk profile in the Northern Cape?
Check, the Northern Cape is a very remote province, vastly populated, and you've got very small communities, and it's basically peri-urban geographic environment. So we've been struggling over the years. It's a historical problem that we've been struggling over the years to get good doctors to come to the province. We've been struggling to get good doctors, to get good nurses. And over the years, our medical health care, and particularly public health care in the province, has been driven on the backbone of Cuban doctors. It's not our first experience to welcome them here. And they've done excellent work over the past years. And we are highly grateful that we've got 11 of them that have been deployed to the province to come and strengthen our capacity. We are highly grateful. We've experienced their work over the years. They can do excellent work, and particularly around issues of primary health care. And we are highly grateful to have them here. And we firmly believe that this will have a significant impact on our work to ensure that we contain the spread and we mitigate the impact of COVID-19.
And where will they be? Where will, how will the doctors that are here, the specialists in their various fields?
Yes.
So how will we fight COVID-19 with the doctors that are here?
The highly specialized team will obviously be based in our tertiary hospital here, which is Robert Sobukwe Hospital, and the others will actually be deployed to the different districts in the province. We've got about 5 districts, so the highly specialized team will be expected to stay here in Kimberley to strengthen the capacity of our tertiary hospital, and others will be deployed to the different districts.
Premier, we've got just over 30 cases currently in the Northern Cape. We stayed on 16 about two weeks ago for quite a while during the lockdown.
Yeah.
What has the lockdown achieved within this province, and how do you see us moving forward?
I think as the province we managed to record major successes during the lockdown, where we managed effectively to contain the spread of the virus. We would normally get 1 extra case in 2-3 days. And when we went to level 4, which was easing of some of the restrictions of the lockdown, we saw an increase in the number of people who got infected. So this is actually a scientific proof that your levels of lockdown have got a direct bearing on the transmission of the virus. So, but with 35 out of 15,000 out of more than 15,000 infection countrywide, I think the province, we are still standing at the right position now. Here in the province, we've screened more than half of the population. We screened more than 700,000 people. And out of the 700,000 people, there's about 2,000 who exhibited symptoms and they were tested. And out of the more than 2,000, only 35 of them got positive results. For us, that's a major victory, and we need to build on that. And we firmly hope that with the reinforcement of our capacity, with the presence of Cuban doctors, we'll be able to craft a much better response.
A lot of people saying that, okay, we're doing a lot of screening, but we're not really doing testing, because we're sitting at just over 3,000 since yesterday, just over 3,000 tests that were conducted. And people saying that once you do mass testing, we'll actually see the infection rate in this problem is actually quite worse than what we think.
South Africa does not have a policy of random testing. You first screen, and out of the screening, if there is any person that exhibits one of the 4 symptoms, you take them for health testing. I don't know of any country that has got a policy of random testing, except what China have just introduced now in Wuhan, where they are testing every one of the 11 million. There's no other country that does that. So what actually happens is there is screening first that takes place. Screening which helps us to identify those who exhibit one of the 4 symptoms. And then from that screening, you take those who exhibit one of the 4 symptoms for testing. But if our figures of positive people were a distortion, then there would have been a large number of people who are dead. The death toll remains very stable in South Africa, which is fairly in relation to the number of people that have been tested positive. So there is no misreading, there is no miscalculation that is taking place, because currently we are sitting with about 15,000 people who have tested positive, and the death toll is about 200. But if we were distorting the figures, making some miscalculation, then we would have been sitting with high levels of people who are dead and less number of people who are positive. So if you look at the two, the number of people who have passed on due to COVID-related illnesses and the number of people who are actually positive, if you look at the global trend, the two make sense, that we could be having 15,000 people who are positive and about more than 200 people that have passed on as a result. So there is no country, we are not conducting random testing. We go out and screen people. In actual fact, we are looking for the virus. We actively go out to look for the virus, which other countries are not doing. In South Africa, our strategy is we go out and look for the virus through screening. And those who exhibit the symptoms then get subjected to test.
Thank you very much. That's the Premier of the Northern Cape, Dr. Zamani Saul. Of course, talking about the province screening and then doing tests. Of course, just over 30 people affected by COVID-19 in this province. But that's it from us for now. Back to the studio.
Well, thank you to Ulrich